We're talking about Medicare not making any sense. So we're down to the very last alphabet letter with Medicare. It's called Medicare Part D. To make it really easy to understand, I would always tell people the D stands for drugs. So Part D covers your prescription drug coverage. The Part D plans are provided by private insurance companies that are approved by Medicare to help with the cost of prescription drugs. See, Medicare never got involved in the prescription drug market, but they oversee how the private insurance companies administer the prescription drug coverage. There are only two ways to get your prescription drug coverage. So this is really important that you understand these two ways that you're able to get Part D when you are Medicare eligible. See, the individual will only have two options to choose from for their prescription drug coverage when they're eligible for Medicare. They can choose, number one, what's called a PDP. This is referred to as a standalone prescription drug plan. See, the PDP will not automatically be included in your original Medicare Part A and B as your insurance. So if you've got Medicare Part A and B as your insurance with the federal government and you want prescription drug coverage, you're going to have to go ahead and purchase a standalone prescription drug plan known as PDP. The second way that someone can get prescription drug coverage is through what's called an MAPD. What that stands for is Medicare Advantage that includes prescription drug coverage. It's called Medicare Advantage Prescription Drug Coverage, MAPD. That means that meets the requirements of that Part D drug plan. All too often, we see those that are eligible for Medicare decline prescription drug coverage because they don't think that they need it because they're not taking any prescription medication. This is a big mistake. There will be a penalty if someone does not have credible prescription drug coverage and does not enroll in a prescription drug plan when they're first eligible for Medicare. So if you're eligible for Medicare right now for the very first time, it is very important that you get some type of prescription drug coverage, whether it's through a standalone PDP if you have Medicare A and B as your insurance, or through a Medicare Advantage plan, MAPD, because there's only certain times during the year that you can actually add a prescription drug plan, and more importantly, there is a penalty that would follow you for the rest of your life if you did not have any prescription drug coverage. Be sure to reach out to us. We've helped thousands of beneficiaries make sure that they have the correct prescription drug coverage in place for their needs so that they do not end up with a penalty down the road. We look forward to hearing from you, and we look forward to making sure that you're taken care of.